I'm NADJMI. I'm a craniomaxillofacial surgeon working in Antwerp. I work in a group of 12 maxillofacial surgeons creating a SMAC group, and we cover 6 different hospitals, and one of them is University Hospital, and I'm responsible for the Department of Craniomaxillofacial Surgery at the University Hospital in Antwerp. At the same time, also the program director for maxillofacial surgery through the University of Antwerp in Flanders, and head of the cleft and craniofacial team of the University Hospital in Antwerp. What the incidence of the cleft concerns, there is a geographical and racial difference. For example, in Belgium, North America, Europe, the incidence is 1 out of 700, 750 births. But for example, in Africa, the incidence is much lower than here. It's 1 out of 2,500 to 1 out of 3,000. Whereas if you go to Southeast Asia, Central America, South America, the incidence is higher than here in Europe and the United States. The treatment of children with cleft deformities, it's in different phases. You have the primary treatment. The primary treatment starts at the age of 3 months to 5 and 6 years. And so we reconstruct the lip in 2 times, the palate in 2 times, and then at the age of 5 to 6, we will reconstruct the bone. Bony surgery causes a lot of edemas, a lot of swelling, and to diminish the amount of swelling and make the patients more comfortable, then we can use a cooling system. The Helotherm is one of the better systems to be used when you do bony surgery. In a number of patients, when they grow older, after 13, 14, 16 years of age, and the number of those patients, the development of the jaw may stay behind. So they have the lower jaw, so they need some orthognathic surgery or jaw surgery. And of course, after the jaw surgery, using a cooling system to reduce the swelling and therefore increase the comfort of the patient is of paramount importance. When we talk about the cooling system, it's of course easier for the patients and also the parents to have a system that it keeps the cooling continuously with the same temperature, that you don't need to change. For example, if you work with hot-cold packs, that you need to change, and the temperature is high and then gradually decreases. So if you have a system that gives continuous with the same temperature cooling, that's of course much more easier and much more efficient to work against the swelling. It is very important to have the cooling at least for 5 days post-operatively. That's very important to have the efficient way of decreasing the amount of swelling and discomfort for the patient. Following our treatment protocol, our aim is to make the children cleft-free at the age of 6. Before they go to the primary school, they should be cleft-free. That's why we do the last stage of the primary treatment, which is the reconstruction of the bone, at the age of 5 to 6 years. And this have a lot of advantages in comparison with all the other protocols that they wait till the age of 9 to 12 years before they reconstruct the alveolar cleft. In Belgium, we reconstruct the soft palate using the robot, which is unique in the world. We are at this moment the only center who routinely uses robotic assisted surgery to reconstruct the soft palate. And scientific research showed that the patients that were operated with robot have a much better results in comparison to those without robotic assisted surgery. And that makes our center more popular in the surrounding countries. So more and more patients find their way to our department at the University Hospital in Antwerp to get treated because of our special protocol. One is the robotic surgery. The other advantage in our protocol is that we make the patients cleft free by the age of 6. after working for more than 15 years in different countries around the world and helping children with facial deformity, we realized that we need a more sustainable approach into the helping of those children, and therefore creating a foundation and raising money so that we could create centers of excellence in the countries in need was an important step for us. That's why I decided to create my own foundation in 2015. And actually the foundation was based on 3 pillars. Free treatments of patients who have no financial possibilities to be treated, one. The second one was to train local individuals to set up centers of excellence with people that we trained so that they could take care of the kids. Not only the surgical care, but also post-surgical care, orthodontic treatment, post-operative follow-ups, speech therapy, social work, and to create a home for these children to be followed up. And that's one of the most important aim of my foundation, the NADJMI Foundation. And the third pillar of the foundation is to create an international network so that we can exchange knowledge, so that we can set up clinical research, fundamental research in the centers that we created, and exchange those knowledge with our knowledge in Europe and in our specific case at our University of Antwerp in Belgium.